welcome back to another episode of Ask a Care Manager. My name is Ryan Abremski. I'm the Director of Business Development, and I'm joined as always with Teresa Jackson, our Director of Care Management. The both of us work for EasyLiving. We're a home care and care management agency serving the Tampa Bay area for over 22 years. As always, the Ask a Care Manager video series is brought to you by our friends at the Senior Living Resource Magazine, and their website is seniorlivingguide.com, your one-stop local and statewide resource for all things senior housing and health. Anything from assisted living to memory care, senior health and wellness, home care, or care management services, again, like Easy Living. Check out the Senior Living Resource Magazine and their website, seniorlivingguide.com. And on their newest issue on page 80, you can see our new wonderful ad in there. So check that out now, and they will mail it to your house directly. So Teresa, welcome back to another week of Ask a Care Manager. We are now in the month of April. Unbelievable that we're already here. And with that, with that being said, we have a couple of awareness topics that we're going to discuss throughout the month of April. So we kind of wanted to talk about one that is, I think, would be considered a little bit taboo at times, but it's something I think that needs to be talked about more and more of an open discussion. And that is alcohol awareness in our senior population. Sometimes, I think we say that our elderly loved ones, it's kind of okay to have the drink, which should perfectly fine it is, but we kind of want to talk about more on the level of it being a concerning and really a health concern issue to those elderly loved ones. So I kind of wanted to talk to you today about what does a care manager do to help maybe a family, identify it, and maybe with some of the concerns that go along with maybe the alcohol abuse in our elderly population.
Ryan, you're absolutely correct. I mean, alcohol abuse is underreported in our seniors and our older adults. It is often a topic that will be ignored by family, by physicians. Not necessarily that they're ignoring it, but they might not realize the extent of an issue that somebody has. Mm-hmm. I recall working with a client many years ago that did have an alcohol problem, and what you see is that when they start drinking, right after lunch, they don't have dinner, so you have the poor nutrition. They're more at risk for falls. There are other medical issues. This particular client was a diabetic, and that medication was staying in the refrigerator. They were not taking their medications properly. So it just compounds any other medical issue that they might have going on. And long-term alcohol abuse can lead to memory issues. So it is something that people need to take seriously. And, when you are seeing your doctor, you need to be honest with them about your alcohol intake. So the National Institute on Alcohol Abuse and Alcoholism, they have guidelines for alcohol use for older adults. So healthy adults over the age of 65 who do not take medications, so how many are there of them that do not take medications, should not consume more than 7 standard drinks per week. So, or 3 standard drinks in any given day. Mm-hmm. So, if someone's having, a couple of drinks every day after dinner, then there you're at 14 drinks. So, but then you have to look at the drink. What is a standard drink? And I know, people will often joke, well, I only have 1 glass of wine, but they have this huge wine glass, right?
A 5-gallon bucket of wine.
Yeah, exactly. But a standard drink is defined as, I'm going to read this off so I get it correct. So 1 ounce, 1 12-ounce can or bottle of regular beer, ale or a wine cooler. anybody drinks wine coolers anymore, or an 8 or 9 ounce can of or bottle of malt liquor, a 5 ounce glass of red or white wine. So a 5 ounce glass of wine, that's a good pour. That's, but that's considered one standard drink. Or a 1.5 ounce shot of a distilled spirit like gin, tequila, vodka, or whiskey. So that would be considered one standard drink. So if you're having, just 2 drinks after dinner, but your drink is 3 ounces of vodka, then that would be 2 times 2. So that's really 4 a day.
Yeah.
And then if you're having those 2 drinks every day, then that's, 4 times 7, that's definitely over the limit that people need to be really concerned about.
Yeah, and it doesn't mean go crazy on one day of the week with 7 drinks.
Exactly. So again, they say, 3 standard drinks, anything over 3 drinks in a day. So one of the other tools that we will use to try to gauge somebody's level of concern when it comes to alcohol is, ask them, how many times in the past year have you had 4 or more drinks in one day?
Mm-hmm.
So, if they're saying that, every day, there's definitely an issue. Or you could say, in the past year, have you ever drunk more than you really meant to? So that in itself could, is a good way to try to get that conversation going. Or have you ever felt you wanted to or needed to cut down on your drinking? So that's a safe question.
Yeah.
That might be easier to get the conversation started.
Absolutely. Yeah, and like you mentioned earlier too, it's not just about them not or drinking and forgetting to take their medications. A lot of medications that are elderly population on, drinking with those medications can really, really send them for a loop. And as you mentioned before, falling is the biggest concern because they can cause potential dizziness.
Exactly. So yes. So anybody that's taking any medications, you really need to read the safety protocol and on those medications. And I doubt that there's many out there that say, it's safe to consume with alcohol. So it is something that, it may interrupt the effectiveness, the efficacy of the medication. So, you might be taking medications and they're just really not doing the job that they're supposed to do because of the alcohol intake that someone might have. So
Absolutely.
It's definitely something to have that conversation. And I mean, nobody's saying, everybody has to be a teetotaler, but, moderation is always the key,
Mm-hmm.
So, have a glass of wine with dinner, that's fine, or after dinner, or have your scotch, after dinner to help relax. But then, keep in mind, is this becoming routine and excessive? And that's, I think, something where it's safer to sit down and have those conversations and just to be aware, because there are things that can be done. There are medications you can talk to your physician about. There's, programs that you can start and work with to try to help cut back on, alcohol intake. We have worked with clients who have memory loss, and we will put watered down wine in their decanters, in their wine bottles, watered down vodka in their liquor cabinet, because it, again, to have them stop completely, and it was not the family's choice in the cases that I'm thinking of.
That makes a lot of sense. Yeah, because then they get the sensation of it and feels like that's still there without having to rip the carpet out from underneath them, kind of thing. So.
Yeah, exactly. I mean, if someone's in their 80s and this is a habit that they've had, a lifelong habit, just try to make it as safe as possible. And then looking at, what other safety precautions can be put in place, and I think about shoes all the time because, you've got to be careful with the types of shoes you're wearing. I'll go into start working with a client and we're like, okay, the heels have got to go because mom can't manage them anymore. It's a fall risk, as much as pets are a great companion, they can be a fall risk as well. So we'll look beyond just the alcohol to help keep someone safe.
Absolutely. Well, thank you so much, Teresa. And for anyone that has any kind of questions, feel free to comment in the comment section. Or if you want to send us a private message through Facebook, you can always message us on there. And then as always, you can fill out the contact us form right on our website. And we'd be happy to send you that alcohol assessment. And again, if there is a concern, our care managers will be happy to assist you or your family members kind of, have that conversation and learn how to approach that delicately with your loved one that you may be concerned about. Definitely. So we thank everyone for joining us, and we will see everyone next week. Thank you so much.